This technique maximizes the intake and uptake of oxygen as well as the expulsion of carbon dioxide. On the inhalation, the way we maximize is first thing we do is we take the tip of the tongue, represented by my finger, we place it to the roof of the mouth. Then we curl it back, maintaining contact with the roof of the mouth, gently. We don't want to strain. We're not trying to push the tongue all the way back. We're just going gently as far as it will go. And then we hold it there, maintaining contact with our mouth closed. And we inhale gently and slowly through the nostrils. As we inhale through the nostrils, be mindful of the fact that when you're breathing here, you feel constriction here, as in you're breathing up here. That's upper level breathing, upper chest breathing. Also, this area is known as the fight or flight region, and in the Egyptian mystic system, the animal nature of man. When you're breathing, and instead of feeling constriction here, you actually feel the air hit the back of the throat. What's happening is the air is getting into the lower regions of the lungs, which is the relaxation meditation portion of the lungs, also known as the God nature of man. And we're all, on our path to be as godlike as possible. So doing this breath sets up meditation and your walk towards godliness. So as we do this, we want to be mindful that the lungs are like containers, and you want to fill them from the bottom up. So you want to empty them fully. If you are breathing and you're breathing up here, since the lungs are triangular in shape, if you're breathing, like I said here, you're probably breathing lengthwise 1/4 to 1/5 of your lung capacity, lengthwise. However, since they're triangular in shape, you're breathing less than 1/5 of your lungs' actual capacity. And one exercise I would like for everyone to do before we start is to take out a timer and count the number of breaths you perform naturally, normally in your regular space in 1 minute. Pause for that now, count, and we'll resume. Okay, now you're back. Let's continue. Remember to write that number down. You're going to use that number as a gauge throughout this whole process and throughout life to let you know where you are, not only in your body but in your spirit. If you're breathing 15, 20, 30 times per minute, you're functioning in the animal space. Typically, you have a lot of anxiety and issues that come along with that. So we want to make sure that we're getting full breaths, and we want to stay in the optimal range. The optimal range is said to be 8 breaths per minute. So anything around that space is a good space for you to be in. 9 or 10, not so bad. 5 or 6, even better. Okay? And this is, again, your normal breath. One good exercise to do while we're going through this process, or while you're transitioning to an increased breathing capacity, is to take a mirror, a bathroom mirror, and fog that mirror from one side, top to bottom, and just do a little hash mark whatever point you end, and notice incrementally where that hash mark ends. That'll let you know that you're increasing your breathing capacity. And as you increase, you're going to notice also that the number of breaths per minute are going to decrease. Okay, now let's get into the breath mastery technique. I'm going to place the tip of my tongue to the roof of my mouth. I'm going to curl it back, and I'm going to inhale slowly. As I exhale, I'm going to release my tongue, drop my jaw, open my mouth to a full oval, and exhale with a Now on the exhalation, we're exhaling with a because that is what's known in yoga as the cleansing breath. And that cleansing breath actually pushes the diaphragm up dramatically so as to push air from the recesses of the lungs. Quite often when you're shallow breathing for years, sediment accumulates in the lower portion of the lungs, and over time it actually has a cascading effect. You have sediment in the lungs, in turn you wind up having sediment or accumulation of waste and toxins in the organs, because the diaphragm is the pump. The diaphragm and also the abdominal muscles are the pumps for the internal organs. When we don't activate those dynamically, we don't get that pump, that squeeze on the organs. What happens in this process is, as you inhale slowly and gently, the diaphragm gently presses down on the organs. As you inhale slowly, as you exhale slowly and gently, maintain that sound throughout. It causes the diaphragm to come up, create a vacuum, and then in turn, the abdominal muscles, as you extend the exhalation, squeezes on the organs front to back. So you get this dynamic squeeze up and down and front to back on all the organs, which are basically bags that filter waste. And you want to keep that waste moving rather than accumulating. As I say in my book, get rid of the waste, get rid of the weight. So back to the breath. Do 5 breaths. Tip of the tongue to the roof of the mouth, and please flow with me. Curl the tongue back, inhale slowly. Release the tongue, drop the jaw, exhale with a. Curl the tongue back, inhale slowly. Release the tongue, drop the jaw, exhale with a. Curl it back, inhale again. Release the tongue, exhale with a. Once again. And one more for good luck. What I would also like to mention in this process, pay attention to what's going on here. As you exhale, the abdomen should be getting flat. As you inhale, the abdomen should expand. So just a quick demonstration of what's happening with that. With your practice, don't stay with the number of breaths that we're doing here. You want to augment your practice, so as time goes on, use this as your foundation and increase the number of breaths over time. I would say start out at 5 or 6 initially, and over a 2-week period work your way up to 9, 3 to 5, 2 to 5. Yeah, by the end of a month, I want you to be doing about 12 to 15 breaths of this particular breath as you do your practice.